You're watching News Desk with me, Bernice Abubedulan. So let's talk about COVID-19 because right here in Ghana, we are seeing our numbers in the region of 900. Well, the Ghana Medical Association has this caution for you.
Did you know that the number of COVID-19 cases in Ghana is going up gradually? This is largely because of the relaxation in the COVID-19 preventive protocols. The Ghana Medical Association is calling on all Ghanaians to observe the necessary preventive measures. Let's wear our face masks when we have to do that. Let's observe the necessary social and physical distances. And above all, let's observe the necessary hand hygiene. Be responsible and keep safe. Thank you.
320 deaths so far due to COVID-19. 48,055 confirmed cases at present. Over 500 active cases confirmed. Many more have not reported for diagnosis, and they live among us, in our homes, our churches, our restaurants, our offices. Would you help prevent this second wave, as many countries in Europe are experiencing second waves? Let's stick to the COVID-19 prevention protocols. Observe strict hand hygiene, wear your face mask, observe social distancing.
Keep your distance. Physical distance is still a must if we must avoid a second wave of COVID-19. Think twice before you join a crowd. Is there enough space for adequate social distancing? Before you speak to anyone, take 3 steps back. They can still hear you. Let's all come together to avoid a second wave of COVID-19.
But I've been infected already. Can I get infected again? If I get infected, would I infect others? Wow, there's a lot we are learning about reinfections. But yes, data suggests that reinfections are possible. Therefore, to err on the side of caution, let's continue to wear our mask, especially in public places. Wash your hands frequently with soap and water, avoid crowded areas, and ensure social or physical distancing. Let's help prevent a second wave.
We have seen the impact of COVID-19 on various sectors of our lives. The hard decisions on restriction of movements. It is difficult to predict the outcome of a second wave. Let's all come together, wear our face masks, observe the protocols, hand hygiene, and social distancing. Let's prevent a second wave.
You are very much appreciated here, you, my audience, and so please stick to the COVID-19 protocols and stay alive. Well, elderly persons and health workers in care homes in the United Kingdom have begun receiving COVID-19 vaccines. The vaccines available in some countries are being given to these specialized groups who are considered vulnerable due to the nature of their work or their age. Egypt is the only country in Africa which has received 100,000 of the China-based Sinopharm COVID-19 vaccine. And that's enough to have 50,000 people inoculated. Well, why don't we find out what it feels like to have the COVID-19 vaccine? We know that in the UK, Pfizer and BioNTech have started vaccinating. Joining us for this conversation is a healthcare assistant in London, Dorothy Ofusu-Asante, who's had her first shot of the vaccine yesterday. She joins us via Zoom. Hello, good morning to you. First, tell us how it feels when you get that shot.
Hello, good morning, Ghana.
Good morning.
I'm Dorothy Ofusu-Asante. I'm a carer in one of the private care homes in London. And then I think the government asked all carers in the care home to have the vaccine first. So at first it was scary, but I think one of my friends who friend was put to the testing earlier suggested to me that if that person has survived, then we can also survive. So she encouraged me. She went to have it first last week. And then yesterday I had it. And it's okay. It's just like a normal flu vaccine, which you don't have any pain. From yesterday, I haven't had any pain. I just have paracetamol paracetamol, and then I'm fine and back to work. Yeah.
So it doesn't leave any burning sensation or anything of the kind. It's just normal.
Yeah, a little bit. I think we all know when we have our little babies, even when we have their immunization, they all have a little temperature and a bit of pain there. But before I had my vaccine yesterday, I took paracetamol a night before. And then yesterday, before I went to have the vaccine, I took another paracetamol, and I'm fine. I'm very, very fine. I haven't had any reaction at all.
I still see that you've got your mask. Yes. Is it that for those of you who've taken the vaccine, you're still being advised to adhere to the protocols?
Yes, apparently we are going to have 2 doses.
Okay.
So I just took one, and
right.
I think after 8 weeks or 6 to 8 weeks, I'll go back and have another dose, which is the final dose to clear you from the COVID.
All right.
So I think after that, the marks will be exempted from those who have taken it.
Okay.
Yeah.
But is the second shot compulsory? Are you monitored to ensure that you have really, taking the second shot?
Yeah, you book a date for that. I think when I called to book the first dose, I was asked to book for the second dose as well.
Okay.
And then yesterday, they put the date there, which is on the 14th of January. I'll go for the second dose, yeah.
We've heard a lot of rumors and a lot of conspiracies about...
I think that it's the blacks scared it's there for them for testing. But I don't think it's for only blacks.
Okay.
A lot of the white people here, my managers are all white. They all gone for the vaccine.
Okay.
So it's for everyone. It's not about the blacks.
Okay. Those who are scared of having side effects, there are a lot of rumors, conspiracy theories. Did you have any doubts personally when you were going in for this, thinking about side effects and all the conspiracy theories around the COVID-19 vaccine?
Yes. I was very, very scary. Initially, when we were called and then were told to go and do the vaccine, I was the first person to say, no, I'm not going to do it. And even when I went home, I was so furious. I was telling my husband, they can't force me to go and have it. But later, a friend of mine told me she's from Brazil, and then she told me she was going to have it. So I said, okay, you go and have it. After you have it and I'll see how it goes, then I'll go and take mine. And then I think few of my colleagues have gone for it, and then they have got no reaction at all. And the next day they are back to work. So I decided to go for it. And yesterday I was so shocked when I went, there was a queue.
Okay.
A queue. Yeah, a queue. So I would urge everyone, if you qualify for it, go for it. There is no any scary part of it at all.
And well, I can still see that you're at work. We'll leave you to go. But right here in Ghana, we haven't had any news of receiving a vaccine yet. And there are a lot of us here who are waiting, hoping that, well, we receive that good news.
And yesterday, the doctor was telling me that it's a very expensive dose. And then I think very soon new ones are going to come.
Okay.
And then probably you have to later on, after a year or two, you have to pay to go and have it. So just if you have the chance, just go and have it. It's just like the normal vaccinations we have during our childhood age, polio and meningitis and everything, in the normal flu. So don't be scared, go for it, and then you'll be fine. You just all want to be happy life and then move on. Yeah.
Thank you for sharing your story, Dorothy. We wish you all the best. And that's Dorothy Ofosu-Asante. She's a healthcare assistant in London. She's sharing her experience having taken the COVID-19 vaccine, and that particular one being used in London is produced by Pfizer and BioNTech. But like she said, there are many others. We have Moderna and we have the other ones from China that we understand Egypt has procured. We will wait here to see what happens in Ghana.